Dr. Stepovich, most of us have the perception when we talk about orthodontic braces that, the whole mouth is playing piano and it is like from here to here, crooked, ugly, up, down, left, right. And that's when we should go and see an orthodontic. And that's with no doubt probably true. Now, what about the person who has one or two teeth in the front, usually, maybe even in the back, I don't know, crooked, and, all he thinks is, let's, take them out, put an implant in it, or let's grind them down and put a veneer on it, or whatever. What does orthodontic have to offer for those people, if at all?
Well, one or two teeth. There are many patients come in and say, I just had this one tooth I want to take care of, and then when we do the examination, we find out that there's a lot more to what we're looking at that needs to be corrected than that one tooth. But occasionally there is just the one tooth to take care of, and that is an Invisalign case. That's when we can use aligners to move that tooth, and that can be done quickly. Other times, you need, say they're only in the lower teeth. There are just a couple of lower teeth that are moved, and if they happen to be certain teeth, Invisalign can't handle that, and you have to put braces on, so you just put braces on the bottom teeth. So it's a partial treatment, but it's only done on the lower teeth. And occasionally, you can do the same thing in the upper. So there are partial treatments that go on, but you need to have an examination to find out what needs are, and it's typical that we have to have a bite that's correct in the back.
Okay.
If everything is working...
Go ahead.
If everything's working in the back, then it might, a partial treatment of the upper or lower teeth can be done.
Okay. Well, so let me ask you this question. I have a couple crooked teeth in front, and, and they're sticking out a little bit, or lots, whatever. I'm thinking of, should I go to a dentist, a cosmetic, dentist? Should I go to an orthodontic? Would it be wise for the person to go and get both examinations and both viewpoints and then make up his own mind about it?
I think more and more people do that. They do not only go and see a dentist and an orthodontist to make that comparison, but they see a number of orthodontists to get ideas on how treatment can be done. And that one is where a patient can really become super confused in getting so many opinions, and they don't know what to do with them.
Okay.
And
tell us more about it.
So that is the danger of doing that. But it's not, that kind of a patient that does that in medicine and goes to see all different physicians and does these things, they really have a difficulty. Well, we're not dealing with a life and death situation with teeth, but yet sometimes you have to. I think the patients really run around and want good recommendations from someone. So somebody that has had nice treatment from an orthodontist, and then they take that as word, and then they go see that orthodontist and let them do the treatment because they've done treatment for friends or.
No, I understand. That's for no more wrong. But should a person on that one, should he visit? So just more or less, is it usually confusing? Yes or no? Should a person with a two crooked teeth, should he go and look at a normal dentist, see that what he says with implants and whatever, or should he first see that guy, first the other, or should he only see one and do what that guy says?
Well, that's a difficult question to answer for an orthodontist to say. I think the orthodontist would say should see the orthodontist first. Or the patient should say, okay, I'm going to see both of them before I decide.
Right.
I'm going to see a dentist, and I'm going to see an orthodontist, and see what we have that can be done. And that way, I think that would be a better approach to that single tooth or having, going to someone says, okay, I had to have all these teeth ground down and new facings and laminates and these things put on here, and it costs a lot of money to do that, but I got the nice result. And then the patient says, well, how much are you cutting? It was a lot. And they said, well, maybe I don't want to do that. And so that patient should try and see an orthodontist. Because there are a lot of ways to take and have successful treatments. There's so many ways to skin a cat. I don't know if that phrase is used anymore. But anyway, there are a lot of ways to do a lot of things.
Sure.
And then you need to have faith in the person who's telling you that they can do something and they really can produce and deliver what they say.
And align it with what you want. The patient should align it with what he wants, and then considers the finance, considers the fact that being grinding down a tooth, is it a good thing? It's a perfectly good tooth. Why do it? Or whatever it may be, and then just trust. Hopefully has an orthodontist and a dentist whom he, both of them, trusts, and that, those two guys even work together a little bit. Well, anyway, Dr. Stepovich, the important thing is one or two teeth in front or wherever can be straightened out. And in many cases, if a person has one or two teeth which he thinks are crooked, there really actually are more of them crooked, which is what causes the one or two teeth to be crooked, that visible. And only an examination can show what really needs to be done.
Yeah, we need the exam, and then the patient needs to make up their own mind on those things. Generally speaking, it costs more to do crowns and veneers and implants than it does to do orthodontic treatment.
Thanks a lot, Dr. Stepovich.